Hey guys, this is Kevin Budiszewski, and this is the RAS system. Let's begin. So this is going to be a discussion of how the kidney regulates blood pressure. This is one of the most important roles of the kidney, and it's done using the renin-angiotensin-aldosterone system, also known as RAS. Note the order of the hormones here. Renin, angiotensin, and aldosterone, which is also the order of the pathway. Since the kidney is trying to maintain blood pressure at a normal range, any deviation from this normal range, whether it be high or low blood pressure, will cause a change in RAS. Do you guys know any stimuli that'll stimulate the release of renin into circulation? Well, a decrease in blood pressure, reduced delivery of sodium to the macula densa cells in the distal tubule, or increased sympathetic tone will all lead to increased release of renin from the juxtaglomerular cells. Additionally, decreased renal perfusion pressures are detected by renal baroreceptors in the afferent arteriole. For a little anatomy tie-in, do you remember where in the neck we have baroreceptors? Good, that would be the carotid sinus. And what nerve innervates this? That would be the cranial nerve 9, or the glossopharyngeal nerve. So where are these juxtaglomerular cells located? Well, they're modified smooth muscle cells that are found here in the afferent arteriole. All three of these changes will occur in a state of low blood pressure, such as blood loss or severe diarrhea. Renin is an enzyme which converts angiotensinogen, produced by the liver, into angiotensin 1. Angiotensin 1 is then converted to angiotensin 2 by which enzyme in the lungs? Good, that would be ACE. Angiotensin 2 has a number of effects to increase blood pressure. It stimulates general vasoconstriction, as well as constriction of the efferent arteriole in order to maintain GFR. It also stimulates the release of aldosterone from the adrenal gland, which stimulates the reabsorption of sodium and therefore water in the collecting tubules. Angiotensin 2 also stimulates the release of antidiuretic hormone from the posterior pituitary, which regulates serum osmolality by allowing water to be reabsorbed through the aquaporin channels of the collecting duct. A slightly less known fact about ADH is that it also stimulates the reabsorption of the urea in the collecting tubules to maintain the corticopapillary osmotic gradient. So what would happen if we didn't have this gradient? Well, recall that water goes to where there's a higher concentration of solute. So if we didn't have urea to maintain this corticopapillary gradient, ADH would still open aquaporin channels, but there would be a lower drive for water to be reabsorbed because there would be less solute. So quickly now, do you guys remember the receptor that ADH binds to in the principal cell membrane? Good, that would be the V2 receptor. Finally, angiotensin 2 stimulates the reabsorption of sodium in the proximal convoluted tubule, which will bring water with it. These are just a handful of ways in which angiotensin 2 increases blood pressure. That's why taking a drug like enlopril, which is an ACE inhibitor, is such an effective way to lower blood pressure, because it renders these angiotensin-mediated pathways less effective. One more hormone to know about is atrial natriuretic peptide, also known as AMP. This hormone works against RAS. Do you know what causes the release of AMP into circulation? Well, it's kind of in the name. It's stretching of the cardiac atria due to increased blood volume. Can you think of a cardiac pathology that might result in an increased AMP secretion? Well, one example would be mitral stenosis. If this is a high-resolution image of your heart, this would be the right atrium, right ventricle, left atrium, and left ventricle. So normally, your mitral valve would be right here. Imagine this valve got stenosed such that it was harder to push blood from the left atrium to the left ventricle. Well, this would result in higher pressure here in the left atrium, which would result in stretch of the left atrium. This then would cause increased release of AMP, which would act against the RAS system. The actual function of AMP is to relax vascular smooth muscle in an effort to lower the blood pressure. It also increases GFR by dilating the afferent arteriole. This allows blood to continue to be filtered while reducing the blood pressure. AMP also decreases renin release, again to decrease blood pressure. So RAS is a very important pathway, especially with the high prevalence of hypertension in the United States. So knowing this pathway, as well as its inhibitors, such as AMP, will be really important for you guys on test day, as well as for your clinical practice.